Hello and welcome. In today's video, we will be discussing public health nurses. By the end of the video, you will know what a public health nurse is, the requirements to become one, where we work, and the skills needed to be a public health nurse. Hello, if this is the first time you are watching any of my videos, my name is Mayela and I make videos on my life as a nurse and thrifting. But today we are going to be discussing public health nurse. So a little background about myself. I am a registered nurse currently working as a public health nurse, and I make a lot of day in the lives of a public health nurse video. I'm going to be saying that so many times during this video, so somebody count and let me know how many times I said public health nurse. But anyways, I get questions all the time of people saying, what is a public health nurse? What do you guys do? I've never heard of anything like this before. So I decided to make a video for you. And if you have watched me before, I am in a new setting. I actually set up a different area of my room and I am loving the way it looks back here. So let me know, how do you like it? So let's get started. A public health nurse is a registered nurse who takes care of whole communities or groups instead of a small group, like in the bedside setting you might be taking care of 2 to 5 people. So public health nurses take care of whole communities. As a PHN, we manage health programs that can be in relationship to maternal or child health, communicable diseases, or other school run or nutrition programs. We also act as a resource in the community and work closely with other community organizations. We also build healthy, safe environments and can work in the setting of a home, school, a clinic, or in a community. We advocate for clients and link them up with the appropriate resources to have better outcomes of their health. And we also work closely with healthcare providers and community clinics. Now you may be asking, what are the requirements to be a public health nurse? I know that I'm speaking for myself. I'm not sure if it is the same in every state in the United States, but I am from California, and in California, a public health nurse is a certification that is received by a registered nurse. So you do have to have a registered nurse license, and like I said, in California, once you complete a bachelor's of science in nursing degree, you are able to apply with the Board of Registered Nursing here in California to get a public health nurse certificate. Usually when you send in your application, you do have to send in a formal transcript from whatever school you went to. They do look at certain classes or courses that had to be completed in order to get approval to get a public health nurse certificate. And usually you do need experience working as a registered nurse. I would definitely suggest, if this is something that you are interested in, check with your local state's Board of Registered Nursing for all the information that you need. I'm sure you can find it there. And when you do get a bachelor's, a BSN, so that's a bachelor's in science of nursing, you do focus on certain topics like pathophysiology, pharmacology, nutrition, issues in nursing, community health, and things like that. So now you know a little bit of what we do, what kind of requirements are, what kind of education is required to become one. And now let's talk about where public health nurses work. One of the places that a PHN can work is community health organizations that is usually run by the county. So in my case, I do work for my local county's health system. And like I said, that is one of the main areas that public health nurses work, so with community health organizations. Some other areas that one can work as a public health nurse are nonprofit organizations, government agencies, I would say clinics, in community health outreach within clinics or hospitals, also in the Department of Public Health. So when a public health nurse works in that setting, they are working a lot in creating new health policies. So it is a great role. And also currently now during the global pandemic that we are currently living in, public health nurses are vital to do things like contact tracing and just following up with people in the community that maybe come up positive or that have been exposed to somebody who has come out positive for COVID-19. As you can see, public health nurses do work in quite a wide variety of settings that is different than just working at a hospital. And if you watch any of my videos, you know that I'm always advocating for or telling you guys that if you are a registered nurse, you don't have to work just in the hospital. There are so many opportunities for us as registered nurses and settings that we can work in. So public health nurse is another type of registered nurse that can work in so many different settings. So don't ever limit yourself. Now that we talked about the kind of places that PHNs work, next let's talk about the skills that are needed to be one. Some of the skills that you do need is communication skills, working independently. If you watch some of my day in the life videos, you know that I mostly work out on my own. I do work as a public health nurse, like I said, for my local county's health system with farm workers. So I'm usually out on the farms all by myself the majority of the week. So you do have to be able to work independently. You have to have strong hands-on nursing skills and nursing triage and nursing assessment. And the biggest thing that I would say that really stands out for public health nurses is that we work with the underserved populations. So you usually will see a PHN working in areas that, like I said, have underserved population. So it can be with the homeless, with the farm workers, in other rural areas, and just like a wide variety of settings, but usually is with the underserved populations. You also have to be pretty adaptable because usually you are not working in a clinic or hospital setting. You are working out in the community. If you've seen some of my videos, again, I'm going to be referencing my videos because it just shows you exactly what I'm talking about. But you have to be adaptable. I usually, I do a lot of hands-on skills like blood draws and blood pressure checks, immunizations. And a lot of those I'm actually doing in the back of a car, on a bench, on a farm somewhere. So you have to be adaptable and flexible with the area that you work in. I do work some evenings too, so you have to be flexible with the time of day that you are working and the working conditions that you will have. Of course, you want to be safe in any kind of nursing role that you do have, but as a public health nurse, you will encounter some challenging locations that you'll be working on, just like in the back of a truck. So public health nurses do work, like I said, in a variety of settings, and sometimes they will be providing hands-on nursing skills, and sometimes it is more like case management. I know for me, like I said, I do a lot of hands-on nursing skills. So we do a lot of immunization, lab draws, blood pressure check, ear lavage, nurse triage, phone triage. So you do have to be pretty comfortable with those kinds of skills. That's why it's usually recommended that you do have some registered nurse experience before working as a public health nurse, because those are going to come into play, and you do want to feel pretty comfortable in your comfortable and confident in your skill level. So those are some of the skills that are required to work as a public health nurse. We also do home visits and we advocate for our patients. Sometimes we do work closely with the hospitals or different clinics to go look for patients. Sometimes they may not be able to reach somebody, so they will call upon us to help locate certain people in the community, especially if we work in that community. We will be a great resource for the clinics and the hospitals because we are out there every day closely, and we know a lot of the members, and they know us and trust us. So that is some of the ways that we work closely with the hospitals and clinics. So this is my first time being a public health nurse, so I am also learning with this video that I made. I did do some research, look at some articles, and so some of the things I am looking down because I'm reading some of the information that I want to make sure not to miss. So a little bit more of what we do is do analysis and assessment of the community. So we are paying close attention to the things that are happening in regards to health. Sometimes maybe if we see an uptick of cases, say of tuberculosis or some other STD or communicable diseases, we can alert our team or our higher ups to start investigating and do data collection so that we can catch it before it becomes a very big problem. So that is something that public health nurses do. We also do some program planning and policy development. So like I said, I am my community that I serve is the farm workers. So there are certain things that I may plan or implement with my population so that I can better their health outcomes. And we also use evidence-based practice to provide care for our populations. Public health nurses also initiate programs, like I said, in regards to a lot of different things like maybe STDs, immunizations, nutrition, weight loss, diabetes education, anything that is related to health of the whole community or the population that you serve. So by now I have discussed what a public health nurse is, the educational requirements, kind of places that we work at, the skills that are needed, and a little bit more about public health nurses. I hope that you found this video interesting, or if you've always wondered what a public health nurse is, hopefully you now have some insights and more knowledge. And if you are interested, hopefully this gave you the information that you needed to make a decision. I do want to do another video that I will be interviewing another public health nurse, just so you can see the variety of settings that we can work in. I already do have somebody in mind, and she works in a completely different setting than what I do. So it will be interesting to see a perspective of two public health nurses, and just to see what the differences are in our roles and the communities that we serve. So also, if you like nursing videos, definitely subscribe. I make a lot of nursing videos. I have a bunch of day in the life of a nurses, a lot of sit down videos. I do like sitting and doing education type videos for you guys. So also let me know if you have any requests for any upcoming video topics, or if you have any questions in general. I know that I really enjoy getting the messages from you guys. Some of you are students, some of you guys are already nurses, some are trying to get away from the bedside. So I love hearing from you guys, either in the comments or you can private message me. I'll also leave an email address down below. I just opened up an email for my YouTube channel, so if you have any questions or longer questions, you can send them there and I would be happy to read them. Like I said, if you like nursing or thrifting content, please subscribe. I make new videos every Sunday, and thank you so much for watching. I will see you on my next one. Bye.